Good evening. My name is Michelle Naccarati-Chapkis, and I'm Executive Director of Women for a Healthy Environment, a nonprofit organization that through education, advocacy, and technical assistance focuses on environmental exposures that impact public health. We'd like to thank the Allegheny County Health Department for hearing our comments and recognizing the urgency of protecting health for residents of the Mon Valley. We support much of the proposed settlement, including mandated repairs and updates that will result in better air quality for the region. However, there are various points of concern that must be addressed before moving forward. The penalties at hand are a nominal punishment for the risks so many residents face from simply living in the affected area. USSteel has no incentive to overhaul their 50-year coke batteries and pollution control mechanisms. The settlement still functions as a pay-to-pollute agreement. For this settlement to be impactful, it is imperative that ACHD remain vigilant in enforcing that these repairs and updates happen in a timely manner and that the community is informed throughout this process. We are also in support of the creation of a community benefit trust that will be used to improve and aid the health of communities that have been most affected. This may be achieved through engaging in a participatory budget process, which ensures that there is a high degree of transparency and input from local community members. Those who live in the impacted communities, including residents, local officials, health professionals, school representatives, and local civic and faith-based, community-based organizations. The participatory budget process has been used by communities to decide how public and/or municipal funds shall be used throughout a democratic process. It has successfully been used in over 3,000 cities across the globe, including here in Pittsburgh through the Pittsburgh Public School System. This process includes forming a steering committee to create rules and an engagement plan. This committee would be, again, community-based and composed primarily of residents living or working in the community. Brainstorming ideas from residents to share and discuss issues and solutions in the community. Developing ideas into feasible projects by engaging community volunteer budget delegates, as they'd be called. Having residents vote on proposals that advance community needs and objectives, and funding winning projects. This process successfully engages the community in every aspect of fund allocation. Engaging in the participatory budget process requires some support from community groups, foundations, and healthcare professionals to assist with logistics such as identifying polling places for voting and assigning mentors to a project if necessary. This is an opportunity to bring community members together to reimagine a healthier future for all, a future where we do not have to choose between clean air and good-paying jobs. Again, we ask that these terms of the settlement are considered carefully so that they hold USSteel accountable to the degree that they have continued to protect the health of all in our region. It's not enough to reduce exposure to air. Let's find solutions.
Thank you for your comment.